Common antidepressants for dysthymia. So kind of the way that doctors, psychiatrists look at things is you've got euthymia, which is feeling normal. Then you've got hypomania. Then you've got mania. Going back to euthymia, you've got dysthymia, okay? And if it lasts for an extended period of time and meets enough criteria, you can consider it, a major depressive disorder. And if it goes for a really, really, really long time, you could call it persistent depressive disorder. So if somebody just doesn't feel good, if they're just, I just don't feel good, doc, I just feel down, I'm not feeling well. First thing I actually do is I don't typically prescribe meds right off the bat. First, I'm gonna look to see if there's any reasonable cause that you could be feeling this way and address it. Do you have a good social support group? Do you have friends that love you, that you spend time with? Are you eating close to 3 healthy meals a day? Are you getting daily exercise? Do you have hobbies that you enjoy, that you're partaking in? Do you have goals that you're working towards? Are you making progress in those areas of your life? How many hours a night are you sleeping on average? What kinds of things do you think about normally? How do you view yourself and the world around you? Has something really traumatic happened to you that you haven't been able to process yet? Is your marriage or family life particularly distressing or stressful or unstable right now? I tell you, when someone reports having some dysthymia, it's not always, straightforward. One of these things doesn't always fix it. But I'll tell you, a lot of times it really helps. Sometimes I'll have a patient come in and they're like, I just feel awful, doc. I just irritable all the time and just don't feel good. And I start digging these questions, find out they're only getting 3 hours of sleep a night because they're up all night, on TikTok. As soon as I get them to get some sleep, they're like, come back, I'm feeling better. Things are better in my life. Or somebody is shy and so they spend all of their time alone. And I really encourage them to call up some people that they know and just talk to them on the phone or try to hang out with them and watch a movie with them. And they come back and they're like, oh, I feel so much better. Or I've had one person who was eating like 1 meal every other day and they felt super irritable. And I'm like, that sounds like you're hangry to me. So I started having them eat, 3 meals a day. And lo and behold, they started feeling much better. I'm not saying you're gonna cure all depression doing this. But I'm saying if you're feeling depressed, make sure you're hitting those basic things first. Don't just jump right over those and dive right into medications right off the bat. Depression can be very complex and there can be a lot of things that contribute to it and a lot of factors involved with it. Try to look at the simple things first. If there was one thing that I would criticize other practitioners in my field is that sometimes they jump to the meds before looking into those other things, and they really need to look into these other things and try to address them first. Cognitive behavioral therapy combined with medication has the best results for treating depression and anxiety. Many studies demonstrate this. Cognitive behavioral therapy means changing your thoughts, changing your behaviors to change your mood.